My name is Silvu Brill. I'm a specialist in anesthesia and a specialist in pain medicine, and I'm director of the Pain Institute of Tel Aviv Medical Center in Israel. Marijuana is add to our pain arsenarium in treating pain. Is one of the newest other drug that enter this area, besides being very old in the market for thousands of years, and now is getting his place as a drug, as a medicament, trying to find a place based on research and clinical trials. The best way to treat is what's called trial and error. We don't really know exactly what's the best way, treating by as a drug, like capsules, or using oil or cookies or chocolate. I'm not sure that smoking is the best way to treat any drug, not just marijuana, because it said it have. First of all, you don't need to harm our patient, and smoking by any other kind is a way to harm. But again, it's not a no-no. Many people, our patient, will find that smoking is the best way for them. We don't know, just don't know. In the market, in the Israeli market, exists around 100 species, strains. In Holland exist also few dozens of strains. In this moment, we really don't know to say for this specific disease or for this specific patient, this is the best strain for it. Besides this, many patients are in my practice are taking more than one strain every day. They are using non-psychoactive species during the day and some species of psychoactive properties during the evening, night, to help them to sleep. I think that will pass more than few years since you'll know to match the patient's disease with the best drug or kind of cannabis. This is, by the way, one of the biggest question in the market: where to put the money, what we need to develop. But we are far to have a right and clever answer. First of all, marijuana is not really medical. It's using marijuana or cannabis for medical reasons, and it's not legal. We have in Israel what's called medicalization, using marijuana for medical purposes, but marijuana is not legal in Israel at all. It's prohibited to use if you are not a patient, or to use in the public spaces or any other else. We need, as a doctor, to make a request to the Ministry of Health in order for the patient, in name of the patient, to get approval to have a permit to use marijuana for medical reasons. And Ministry of Health is in charge of giving approval or saying yes or no for the specific patient, or asking for more documents like medical history, what kind of drugs have he or she used in the past for the specific condition. And if they are giving approval, the patient is receiving a letter that he is allowed to use a specific amount of marijuana. Usually the permit is given for 6 months. And the patient is sent to a grower to give him the supply, a monthly supply, and to give also some education for and how to use. And at the end of the day, he needs to come again to the same doctor after 6 months to renew the approval, to renew the request to the Ministry of Health to get again the approval. Probably the situation is going to change in the next months to be much easier and much in the medical way, not sending to a grower, just going to the pharmacy, not to other places. No, it's not. As I said, it's not available in the pharmacies. It's not yet standardized like a drug that can be sold in the pharmacies or in hospitals. The only way to get is that way, to ask for a permission to the Ministry of Health by a doctor specialist in the specific area, getting the approval and be sent to specific points or stores to receive it. It's not available in the medical area like pharmacies, hospital, or this kind of facilities, because it's not yet a drug. You can sell only drugs in the pharmacy, not something that is not drug, is not food additive, like vitamins. It's not, no. As I said, probably the situation is going to be changed in a few months. Yes, there are a few growers they've been approved by the Ministry of Health, Ministry of Agriculture, and by Israeli police that can cultivate, can grow marijuana under very clear and specific circumstances and rules.